Working with patients. Treating patients with known or suspected COVID-19. Since you go to people's homes to provide care, there are a few guidelines from CMS and New York City Department of Health. Since you work in the patient's home, you need to know the health status of the patient and everyone who has been in the patient's home, including visitors. Please confirm this with your agency. You may need to work with a patient who has confirmed or suspected COVID-19. This may make you feel worried or even scared, and that's okay. But using infection control best practices, similar to what you use when working with patients with other communicable diseases, will help keep you and others safe. Infection control best practices will help keep you safe when working with patients with confirmed or suspected COVID-19. Remember, always contact your agency clinical manager regarding any respiratory illness that presents with fever, cough, or shortness of breath. If the patient is ill, infection control starts with them. The patient should wear a face mask, call ahead prior to going to the doctor, distance themselves from others in the home if possible. When caring for a patient at home, you will provide assistance with these precautions as needed. Infection control is also important for the entire home of the person who is ill. Good infection control practices for the home include washing hands frequently with soap and water or an alcohol-based rub, covering coughs or sneezing into a tissue or an elbow, not sharing personal items with the infected person, disinfecting all common surfaces, countertops, faucets, tables, etc., daily, monitoring for symptoms. Infection control is also crucial for you, the caregiver. Precautions for caregivers working where someone in the home may have COVID-19 include wash hands or use an alcohol-based rub before putting on and after removing personal protective equipment such as gloves or masks. When possible, put on personal protective equipment prior to arrival. Also, remove all personal protective equipment and throw it away in a trash can located immediately outside of the home. Try not to take any items to and from the patient's home. Anything brought in and out should be disinfected. If you are working with someone who has suspected or confirmed COVID-19, here are a few things to keep in mind. If the symptoms are mild, patients may be able to manage at home. However, it is important to monitor the symptoms as the disease progresses. If the patient develops more severe symptoms, they may need to go to the hospital. If you need to call 911 or an ambulance company, tell the person on the phone about the suspected or confirmed COVID-19 diagnosis so they can prepare and stay safe. You should also care for yourself during this challenging time. It is important to note, 80% of healthy people who get COVID-19 get a mild case. Follow the instructions of your home care agency in regards to any changes in policy regarding COVID-19. Remember, stay calm. It's easy to become afraid or anxious with all the news coverage about COVID-19. If you are feeling sad, anxious, or having problems sleeping for more than 1 month, reach out for support. If you live in New York City, call NYC Well for mental health support at 888-692-9355 or text WELL to 65173. All calls and texts are confidential.